Headache. Headache is a common complaint in many neurological, as well as non-neurological disorders. It may present alone or in association with other complaints. Regardless, a detailed history of headache can provide important clues towards the diagnosis. Sudden onset headaches of severe intensity, occurring in a patient without a previous history of similar headaches, may suggest an organic etiology. Acute headaches develop from causes such as migraine, tension type, or cluster type headaches. Trauma resulting in subacute hemorrhage and infections, such as meningitis, are also categorized as acute causes. Chronic headaches occur on and off due to the same primary event. Some examples are chronic migraines, medication overuse, and drugs such as nitrates. Headache may be diffuse or localized to specific structures in the head and neck. Involvement of the frontal and temporal areas in a band-like fashion is seen in tension headaches. The area above the eyebrows and cheeks are involved in sinus headaches that result from infection and fullness of the frontal and maxillary sinuses, respectively. Occipital headaches are seen in occipital neuralgia and tumors in the posterior part of the cranial cavity. The temporal areas are involved in giant temporal arteritis. Frontal headaches are common in migraines and cluster headaches, along with frontal lobe involvement in tumors and infection. Mastoid headaches are common in middle and the inner ear infections, such as mastoiditis. Complications such as lateral sinus thrombophlebitis, also present with headaches in this region. Retroorbital headaches are usually cluster headaches with deep, boring quality of pain. Parietal headaches are rare, also described as nummular headaches. There is constant pain over a coin-shaped circumscribed region over the parietal lobe. The VAS scale, as shown in the image, is used to record the pain experienced by the patient based on the facial expressions. Character. Dull pain is seen in tension headaches. Throbbing pain is seen in migraines, caffeine withdrawals, and alcohol overdose. Pulsating pain is seen in involvement of the blood vessels, as seen in giant temporal arteritis. Sharp, searing pain is seen in cluster headaches. It lasts for a long time and runs in families. Tingling pain is seen in stress headaches, sinus headaches, and patients of diabetes, multiple sclerosis, and autoimmune diseases that cause nerve damage. A sharp, jabbing, electrical shock-like pain is seen in occipital neuralgia. Sharp stabbing headaches are also called ice-pick headaches and generally last only a few seconds. Thunderclap headache is seen in subarachnoid hemorrhage. Constant pain is seen in cluster headaches and nummular headaches. Remitting, acute pain is seen in migraines. Episodic pain lasting about 30 minutes is seen in tension headaches. Cyclical pain may be associated with menses. Diurnal variation may be seen in conditions such as glaucoma, where intraocular pressure rises towards the end of the day. Headache referred to the cheeks usually originates from the sinuses. It is referred to the mandible in giant temporal arteritis. It may be referred to the back of the neck, eyes, and ears, depending on the site of the pathology. Headache that progresses must raise suspicion of an infection or growing space occupying lesion with the cranial cavity. Stress and emotions aggravate tension headaches. Heat, lack of sleep, bright lights, and loud noises aggravate migraines. Other aggravating factors include allergies, eye strain, alcohol intake, and caffeine withdrawal. Patient may often specify that sleep, eating, change in temperatures relieve the headache. A change in posture may relieve headache due to tumors and other space-occupying lesions. Fever and neck stiffness are associated with meningitis. Blocked nose, sneezing, ear pain are seen in rhinitis, resulting in sinus headaches. Excessive sweating, salivation, and tearing along with dizziness and loss of consciousness may be associated in more severe neurological conditions. To get more such high-yield medical content, Don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.